There we are. And I don't see my mouth moving, but I will soon. Okay, yeah, there's a little synchronization that's off from me speaking and seeing, but we have that. Let me just check it on my phone to see if it's. Everybody, it's I gotta turn the volume down so I can see you and me both on my screen here. I'm just looking to see us. Sometimes I have to go back out and then come back in. Let me just get this. How are you, Dr. Geronemus? Thank you for.
Oh, good. My pleasure to be here. My pleasure.
Today for our Facebook Live. I see it now. I've got it. Hello, everybody. Welcome to the VBF January 2023 Facebook Live. I'm very excited to have Dr. Roy Geronemus, the leading laser expert in the world for treating port wines and other cutaneous vascular birthmarks. We're here not only to answer your questions, but we're here to get you a little excited about some of the really amazing, impressive work that Dr. Geronemus and his team are doing. And remember, he's also teaching other doctors to do these techniques because, like VBF, he believes in educating others to do the same type of processes. So while we're waiting for some people, first of all, let us know if you see us, because I'm seeing it on my phone, and I'm seeing that we're live on my screen. So if you could, oh, I see 21 people are on, okay. All right, so let us see some comments. Melissa, hello, Melissa. I'm seeing Melissa. I'm trying to see the comments. Okay. All right, so you guys, having a little trouble with my phone with seeing the questions. Let me get back out and get back in so I can see them. And then I can see the comments. I don't know why it's doing this. Okay. Lindsay Benedict says hello. Gail Friedel says hello. Melissa Delgado Carriaja. Hello. Caitlin Smith. Paige Brittain. Hi, everybody. Welcome to the Facebook Live. Dr. Geronemus and myself are here to answer your questions. Renee is on, and as you all come on, let us know where you're from. And you know, as soon as you have your questions, we're here for 60 minutes. And I know some people will jump on a little later. We always take these first couple minutes to get ourselves organized, but I can see you're all on. I see Liz. Hi, Liz. Hi, Mahala Boban. That's your little buddy's Dora's mom. You know Dora. She's one of your favorite patients, Dr. G.
Exactly.
Yeah, so hi, Caitlin from Alaska, and welcome to our Facebook Live. So while we're waiting for our first question, Dr. G, I've been very impressed with some of your patients that I've been seeing, like Megan, who has a very thickened port wine stain, and you know, she's had a lot of treatments, but it just seemed to darken, you know, after treatments. But I'm seeing you're having like some amazing results with her. What is this new technique you're doing that's getting this amazing clearance?
So what we have been doing is combining two different technologies to help with the thickness of some of these mature birthmarks. So for those of you who don't know, some of the port wine birthmarks as the patients age get thicker and they can get bumpier. And this is one of the reasons why we advocate treatment, is to minimize the chance of that happening as the patients get older. So this particular patient that Linda is referring to, we combined both the pulse dye laser, which is the standard laser utilized for port wine birthmarks, in combination with something called radio frequency with microneedling. So the goal here is to deliver additional heat to the blood vessels safely. And what we found is that the combination technique has worked better for some of these thicker birthmarks. And one of the issues with the lasers that we use, the V-beam or the pulse dye laser or similar lasers, is that the injury is what we call selective. So while that's a great thing and it's safe and allows us to treat babies and allows us to treat safely, sometimes it's too good because the injury is not significant enough, particularly for some of the thicker birthmarks. So we found by combining these two, we've had a much more dramatic response in treating some of these thicker birthmarks. So this has been great for those patients. We're now starting to look at this for some of the patients with resistant birthmarks as well. So hoping that it might, the delivery of additional heat safely without injuring the skin, without increasing the risk of scarring, might provide some additional benefit there as well.
I know I was impressed when I saw Scott, our COO, Scott Couples. He's also the director of our Global Ambassador Program. I told him, I said, your birthmarks never looked better, smoother, clearer. So he's definitely one of the patients that has a pretty thick cobbled stain when you first started working with him, and I'm seeing it flatten and smooth, and I'm seeing good skin peek through. Same with Megan. I mean, proof is in what you're seeing. It's not just anecdotal. You're actually seeing this.
It still takes multiple treatments. It's still an effort.
Right.
But adding this concept of radiofrequency with microneedling has not necessarily increased the downtime to any great degree. Maybe a little bit of more scabbing than we expect to see from the laser alone. But the combination for the thicker birthmark has been something that we're very excited about.
So patients who are in your network who want to come and see you, whether it's their insurance or whatever, it's still considered one treatment, right?
It's still part of the same treatment. Yes.
Yeah, part of the same. That's great. So we have our first question. It's from Jillian Riley. She wants to know, what is the best age to start treatment of her baby's port wine stain?
So it's my belief that the earlier the better. So we published a paper now a couple of years ago where we looked at 197 babies under the age of 1. And this particular paper, which was published in something called JAMA Dermatology, showed the highest cure rate, or at least the highest rate of clearing and the more rapid rate of clearing relative to starting at other ages. Now, this is often site dependent. The face doing much better than certain parts of the body, particularly the lower part of the legs and the arms. But in treating young infants, there is a window of opportunity. The skin is thinner. The blood vessels seem to be more susceptible to laser light. It can be done safely. It can be done effectively. It's also believed that these young babies still have what's called fetal hemoglobin, really from the mother, and for whatever reason appears to be more susceptible to laser light. So if your doctor is willing and able, then I think early intervention as soon as possible can make a very big difference over the long term.
And by as soon as possible, we have to say it, close after birth, 1 week.
Right. I mean, our motto is, out of the nursery and into the office.
Right.
You don't need anesthesia. The kids are small. The birthmark's small relative to what it's going to be. The kids don't remember. It's much easier treatment to do assuming the doctor has a comfort level. Not every doctor is comfortable doing that. But I think once they become comfortable, they will see that it is a far superior way to approach these birthmarks.
Thank you. Well, we have a lot of people on now, almost 50 people waiting to ask questions. So Parto June wants to know, what do you do with a thickened lip that has a port wine stain on it?
So unfortunately, the laser treatment does not work as well on the thicker lips. This combined technique that I talked about earlier, where I'm using a laser in combination with radiofrequency and microneedling, is something we're looking at to see if that might help to some degree. But I'm not overly optimistic that'll make a huge difference. So this is one case where we work together with the surgeons to have that corrected.
But I'm wondering, and I've been thinking about that microneedling as well, is if it's starting to thicken, maybe if we address it in younger people that are just getting the thickening, maybe it can be effective if you use that approach, get it while it's just starting, and maybe use it to keep it from thickening.
Well, great minds think alike. That's exactly what we're thinking about as well. So I think we'll be doing more and more of this as time goes along based upon the early results that we're seeing.
So Shelley Beck-Von Pecos-Byers has a similar question. She says, I have a 27-year-old son in Boston. He has a port wine stain from ear across the cheek and down over his lower lip. His lip is large and puffy. He had laser as a baby. What can we do now?
So I would consult a plastic surgeon or a head and neck surgeon who specializes in this type of thing. It's always helpful to have somebody who has experience in the treatment of vascular birthmarks. You're lucky that you're in Boston because there are great opportunities in the Boston area with surgeons who are very familiar with this concept. And the laser treatments that we do today really started in Boston. So there's plenty of opportunities up there.
Yeah, as a matter of fact, Dr. Rox Anderson and Dr. Branko Bacevich, Branko is a head and neck surgeon, and they kind of work together with Dr. Anderson's team, lasering, and Dr. Bacevich doing the surgeries. So he's out of the MGH and out of Shriners in Boston, if anyone wants to reach out to him. So Caitlin wants to know, do you recommend port wine stain on the head under the hair? Should we treat it or not?
So I generally don't. And the reason is particularly with the young children and even some adults, you can get hair loss that can be long lasting. So this is very disturbing to some patients. So typically what we do, when the hair grows in, it covers a lot of the birthmark. So it's not that visible. So what I tell patients coming in today is let's wait for something better to come along. And perhaps there'll be an opportunity to treat into the scalp at some later point without injuring the hair. But most families, particularly of children, do not want to have their kid, have some what we call alopecia or loss of hair, which could occur, particularly with the immature hair follicles that occur. So we're particularly cautious with that, and also cautious with eyebrows, because you can get prolonged hair loss there as well.
So just out of curiosity, like if it's a male and they've got that beard, chin, jaw, beard distribution port wine, and if you treat them really, really early, then it won't affect their growing a beard later in life, will it, if you can get it under control?
So, I've seen that rarely. I've done tens of thousands of these treatments, over the years, and maybe one or two patients, have complained about this over the long term. But that's a very, very rare event. Very rare event.
Okay. So Lisa Lanza says, hi, I'm nearing 65 years old, I'll say years young, and starting to see the bumps and thickening on my birthmark. What should I do?
So there are laser treatments that can treat the bumps. Typically, I would use a different laser than I would use for the flat part, where I use the pulse dye or V-beam lasers. And when they're bumpy, I would generally use either a KTP or YAG laser. Some doctors like to use an Alexandrite, but I find that the KTP or YAG laser in my hands works better and is safer. So it's definitely treatable. And in many cases, it's worth treating, because you do run the risk of spontaneous bleeding. And if particularly true in men who are shaving, where they can cut themselves, and it's particularly true of women where the birthmark occurs in other areas where you're going to shave.
So the next question is similar. It's from Brittany Carlson, and she says, Dr. G, how likely is the skin to thicken or cobble in adulthood if you keep it treated regularly since birth?
So we wrote a paper on this, I guess now about 30 years ago, in the 1990s, looking at this particular subject, and found that 2/3 of all patients by the age of 45 have some cobblestoning or some bumpiness. So, we believe that early intervention or intervention at really at any age will minimize that. So that's one of the main reasons why we do treat.
And I think too, since early treating like you do is pretty new in the last, say 10 years, we're going to have to wait as time goes on and see. In fact, do these people that you start at birth and start treating them, maybe, if we find one day there is this overgrowth factor and they have it, but they've never thickened, maybe then it is that support that we need to say, yes, thickening is a possibility, but here's the proof. These patients have been having treatment since they were a baby and they're not thickening.
Right.
We'll see that in time.
Certainly something we need to look at.
Right. So Katie says, have you seen similar results on extremities using this new technique? And is the healing process more painful? That's your new microneedling technique?
No, I've not used it on the extremities. Again, the extremities are a different experience altogether, particularly below the knee, below the elbow, makes it particularly difficult. That's why we like to treat those patients as early as possible. If we can get them during infancy, that's your best chance. But many times it's almost impossible to clear completely in those two areas.
But the earlier you start, the higher the rate of clearance you'll get.
You'll get more clearance, and then you have an opportunity of getting a much better outcome.
Thank you. So Tilly is saying hello from the United Kingdom. My 8-month-old has a large port wine stain on half her face, scalp, chest, and arm. We finally have her first appointment at Great Ormond Street next month. Can you advise what I can expect from that appointment?
Well, I'm not sure how they handle things there. Every place is different. Even different places in the US and reputable centers where these treatments take place, people have different philosophies and different approaches. So it's very much physician specific. In some cases, it's country specific. You know, I had a patient come in recently from Norway where they don't want treatment before the age of 1, and they don't use a pulse dye laser. You know, and the family took it upon themselves, and they wouldn't cover the treatment outside the country. So the family took it upon themselves to seek treatment with me in New York because they didn't want to wait, and they were aware of the literature supporting early intervention. So, you know, in terms of what to expect, I don't know. You know, really depends on the philosophy of the physician, the center, and in some cases, the country.
Agreed. And this is back to the microneedling. Gail wants to know, is the recovery itself more painful, and does it take longer? So like, would she be out of work longer?
Not necessarily, you know, maybe a day or two longer, but it's not more painful.
Okay. Now, I guess I missed this, but thank you, Gail, for looping back. And she said, someone on the page is talking about the use of propranolol and port wine stains. I don't know anything about that. Do you?
Some people have tried it. I don't think there's any value in doing so. The propranolol has been used for hemangiomas, which are similar, but not the same as port wine birthmarks.
Okay, agreed. Parto June says her son has done a lip reduction, but it regrows. So the boy does not want to have the surgery again. She wants to know if he starts the microneedling technique, will that keep it from thickening? And I guess you just don't know that.
We don't know. It's still, you know, we're presenting information that's cutting edge and very early and a bit premature to present to the world. So we don't have a lot of answers yet, other than, you know, a limited number of patients with thicker birthmarks where it has made a difference. So I think it's certainly something worth looking at, but we don't have an answer for that just yet.
Okay, well, thank you. And we have quite a few people on, and we are getting to your questions, but also let us know where you're from. So Brittany, what country, state? Brittany wants to know, what do you recommend for treatment or maintenance once the child is school age, and if they've started as an infant?
Well, a lot depends on what's left and where it's located, how large the area is. There are some patients that we clear, other patients where we get 80% or 90%, and there's some patients who just don't respond as well. So for those who don't respond as well, we might offer a bit more in terms of treatments. For those who just don't need it, we won't do anything. And there are some who have a little bit remaining where their families may start to see some darkening, and then we'll hit them again. So, and also, I think a lot depends on the technology that's being used and how it's being used. For example, I believe the technology is improving. So there are a limited number of these large spot size, high energy pulse dye lasers in the country right now in the US, and I think they make a big difference. I think we see more clearing, more lightening. For the patients, it's much easier because it's a faster treatment, making it much easier. So you can cut down the time of treatment in the office setting by sometimes 2 or 3 times. So it makes a very real, significant difference. So my point is that sometimes it's worth revisiting the treatment if there's newer options available that might lead to a better outcome.
And even though we have a lot of questions in queue, I just want to do this statement and have you kind of back me up on it, that you and I know that there are some new lasers coming out, and we're looking for bigger spot sizes and just all kinds of things that make me very hopeful that the best of every laser that we've seen so far is coming together now to give us a more improved device. Would you agree with that?
I don't think there's any question. So there are a number of efforts being developed right now, a number of 2 different devices in particular that do result, I believe, in different options and better and perhaps better options. So it's the larger spot size, the higher energy, perhaps less pain. So you have the V-beam Prima, and the Candela company will be introducing a newer version of that the next year or so. And then you have the Derma V from a company called Lutronic out of Korea, South Korea, which has a large spot size, has a different type of cooling spray, and it's much faster. So it has some real practical benefit for some of the patients with the larger birthmarks.
So if it's faster, I mean, and is the spot size the same as the Prima? Is it that large?
It's even larger.
It is.
Yes.
So where you would have been doing maybe 30 pulses, what are you doing now? Maybe a ratio of 20, or would it be half, 15?
It depends what you've been treating at. Some physicians like very small spot sizes, which I don't. I believe the larger the better. I think we get deeper penetration of the laser light, so we get a better outcome. But the larger spot sizes do allow for a more rapid and more comfortable treatment for the patient.
And less zaps.
Well, that's part of it. You know, you take a 1-year-old, a 2-year-old, and you're cutting the treatment in half in terms of time, right, and you've changed the experience.
Right. Liz, I'm going to answer Liz's question, but you can follow up behind me. Her daughter needs help with dental issues with her port wine. So we have Dr. Darrow. He's on our website. You can find him. He's out of Virginia. He is our dental and head and neck surgical expert who has an excellent paper on dental issues and can discuss with you. We have his email on our website. Some tips that you can have for going to the dentist. Also, since you are from Houston, Dr. Paul Friedman is there in Houston, and he's trained with Dr. G. He's actually on Dr. G's staff in New York, but he has a thriving practice. We just had a free clinic there. So I would recommend that if you aren't, that you would see him. Now, do you or does Dr. Friedman treat the gums with laser, or is it still taboo?
I do. It's not totally taboo. I will do once in a while, but typically not. I leave that to the periodontist to address. But I do recommend that, as these kids get older, that an evaluation by a dentist who's familiar with vascular malformations address some of the issues that may arise. One of the things you may notice as a parent, teeth may come in earlier on the affected side, both in terms of the baby teeth and the permanent teeth. And sometimes there may be more dental issues on the side of the vascular anomaly.
Agreed. By the way, October 6th, 7th, and 8th is our major super clinic and conference in New York with Dr. G as our host. And we will be doing free dental exams, ultrasound, laser, the whole deal that we do. That will go live with registrations in the next couple of weeks. So look at our website at birthmark.org, and your son will be able to get a free dental and orthodontic exam. And these are very, very valuable. I can't emphasize enough how important these free exams are, let alone the free laser, the psychotherapy, everything that we have to offer our families.
But going back to the dental side of things, some of these patients, when there's gum involvement, will have more periodontal disease, more vascularity of the gums. So it does, and the orthodontic issues. So, you know, it's an important part of the whole process. So I think it's terrific that the VBF offers that at the very least to create awareness.
And by the way, Dr. Coletti, who's also a dentist besides a maxillofacial surgeon, and he also does laser, he's recommending to all parents where there is port wine on the gum that they actually have their children's teeth cleaned twice as much, even 3 times, especially adults. He says they really have to go in and have, you know, multiple cleanings. He has some of them going every other month. And he said it makes a huge difference.
Sure it does,
a huge difference. So you can't, and use water picks, whatever, clean the kids' teeth and just try to keep those gums as healthy as possible. Samantha wants to know, how frequently should a baby under 1 be receiving treatments?
So this is an interesting question, something that we've been addressing. We wrote a paper, you know, a while back looking at intervals between 2, 3, and 4 weeks, and found that those babies coming in at 2 and 3 week intervals actually did better than those at 4. And they all did well, but 2 and 3 weeks did better than those being treated at 4 week intervals. Now we've begun to push this even further. And what I'm saying is a little bit unorthodox, or a lot unorthodox. But we're doing some patients now at weekly intervals, and we're seeing some remarkable results. And the philosophy behind this is that you get something called revascularization after these laser treatments. So I was talking about how the laser is almost too good because the injury is so confined to the blood vessel. Sometimes it doesn't create enough injury to the blood vessel. So the blood vessels can regrow a bit between treatments. So we had the idea that if we can increase the frequency of treatment, perhaps we can prevent that from happening. And we're seeing some really remarkable results with even faster clearing. So, I mean, there aren't many people doing this right now. Hopefully we'll have a collection of patients so we can publish this and get the word out. But I do believe that frequent intervention can make a very big difference.
And I just want to address, it's not unorthodox when it's just that people have, there were no rules with laser, how frequent, whatever. Everything's been a learning experience for the 35, 40 years that laser's been used for port wines. I think it is completely logical, because we know these can recanalize or revascularize quite rapidly, to hit it before it has time to do that. That's why I think of everything between the microneedling and the weekly intervals, I am the most optimistic and the new lasers that I've been in 29 years. I think these 3 things, the early intervention, the microneedling when it's thickened, and the larger spot size and the less painful, I think this is the most advanced we've been. I really believe that. Pamela Hamilton wants to know, her daughter has a port wine from her buttocks to her toe on her right leg. We head to Duke next month, but we've heard that the lasers are not effective in the lower extremities. She is under age 1. Do you recommend we have it lasered?
I think you can see improvement. I think it's hard to see a cure below the knee. But if you're going to have a shot at this, the best chance is now. The problem is you can require multiple treatments, so it's a bit of an effort. So I think it's worth a try. Some of these kids do really, really well, but it's true that not all of them do, particularly below the knee, and especially on the foot.
So we have a lot of people from the UK that are on, and one of the things I want to say is we are very well aware that in the UK they're not like us. I've had parents from Ireland and Wales and Norway, and many places say they won't even start until they're 2 or 3 years of age. And it's our philosophy. And with this new shorter interval, I mean, I've seen some of the pictures from the patients, the babies that Dr. G has done. And with hitting them weekly, literally one of the babies isn't even 4 months old and it's almost completely gone. So in my opinion, the family can start like having a normal life without worrying about this birthmark? Because to me, when I saw those pictures, it was like 90% cleared and the baby was only a couple months old. And I mean, it's just so logical. It's and why make the family and the baby suffer any longer? It makes no sense. I think we're going to have pushback, but I think we'll persevere because
I think it's important to recognize what Dr. Linda's talking about is not commonly accepted practice. I mean, this is really cutting edge, novel, information. So it may be a while before the rest of the world recognizes this as a particular option that might be of value.
Well, we've been around long enough, Roy, or Dr. Geronemus, that we've seen things that you did 10 years ago when you went to 3-week intervals. People are like, you don't need to go to every 3 weeks. And now everybody's doing every 3 weeks. And now Dr. Nelson's doing every 2 weeks. So, and Dr. Coletti's doing every 2 weeks, and Dr. Goldberg's doing every 2 weeks, and Dr. Garden's doing every 2 weeks. So it takes time, but they'll catch on, they'll see it, especially if everybody starts going to you. That's the best way they know they better get with the program. So Lindsay's saying, considering somebody with a port wine stain in the V3 area, the temple, the beard, the neck, where are the toughest places in that area that are the hardest for clearance when starting the laser in infancy?
The hardest area is in the central part of the face. The cheek, part of the cheek near the nose, that's where the skin is thicker, a little harder for the laser to penetrate into the blood vessels and get to the depth there. The skin is thinner on the neck, so the neck responds particularly quickly. Also true on the chest. So areas where the skin is thicker, and the blood vessels are deeper, you're going to see a slower response than you would see in areas where the skin is very thin.
Makes sense. Donna has a question. Does Dr. Nelson use this radio frequency micro needling technique? I don't know, do you?
I have no idea. It's not common knowledge. I have mentioned it at a couple of meetings, but time will tell whether others adopt it.
Time will tell. Yahi Liang says, are there new treatments coming out? You already mentioned that. How will the new lasers be different from the current or past lasers?
I think they're in a number of ways. One, you'll have a larger spot size, so they'll be faster and the laser light will penetrate deeper. It should be a little less painful, particularly with some of the newer cooling mechanisms and the faster treatment. Also, the newer lasers have higher energy. So the higher energy can make a big difference. So we're able to deliver, higher energy at that large spot size, and that combination I think is key.
Agreed. So Shelley Byers has a question. Does insurance generally cover the treatment? Well, the answer with that is it's getting worse and worse every day. She said they had to fight back in the 90s, and she wants to know, is it the same as it was in the 90s? Well, no. And then the reason she's asking is she's a professional and has to go to work. So will it clear up quicker than it did back in the 90s? Is the downtime shorter?
So the insurance issue, a lot depends upon where you are. And also depends upon the office that you go to. I think a lot of effort has to be made to fight for the patient. I think the physicians have to be patient advocates to, one, submit the claim correctly to the insurance company to get coverage, to get approval for the treatment, and then if denied, to help fight for the patient. Now, many times it's helpful for the patient to fight for themselves. So one has to be their own self-advocate, in dealing with insurance companies. But a strong office, an office that's used to dealing with it, an office that's going to go the extra mile, and physician. For example, I do something called peer-to-peer reviews with the insurance companies, and I usually win. So, we appeal a denial, and ultimately we ask for a peer-to-peer while I meet directly with a physician, by Zoom or by phone. And, we're often able to get insurance coverage. So
thank you. Oh, thank you for that. She also wants to know, do you have any product recommendations for cover-up?
There are a number of things out there, and a lot depends upon what you're comfortable with. We use here in New York something called microskin, and it's a product that can be matched to your skin color, and it stays on longer. So it's something that can stay on sometimes for several days at a time. Some women like it because, when they're, let's say, out to dinner, it's not coming off on their napkin as easily. But that's a process that has to be mixed and matched to your skin color. If you're in New York, you can get access to them directly, but sometimes you can even do it over the phone. So beyond that, I'll defer to you, Linda.
Yeah, we have people on our website at birthmark.org right on the front, Ask the Expert. There's 2 makeup artists, one with Smart Cover, and I can't remember the name of the other one, but they'll give you even a sample to try it. Pre-COVID, we used to do free makeup sessions for people with birthmarks, and maybe we'll get back to that. Not this year yet, but maybe we will, just because it's, so many people touching skin. But we do have that information on our website. You've been asked this question, and it's another one about what can be done with the stain within the hair, but I'm going to ask it a little more advanced. If the person is very fair-haired or even gray-haired, that red is like a beacon. Right. Is there anything? I mean, I'm thinking makeup, but then the makeup would get on. But
there is some scalp makeup that people use who have thinning hair,
okay.
Where it can be helpful. I don't know how well it covers light hair, but generally, I just simply don't treat the scalp, and I'm hopeful that someday we'll have other options. For example, there's some work being done in China with something called photodynamic therapy. And perhaps that can be something that could be used on the scalp. That is not generally used in this country, but perhaps it will at some point. I know the Chinese company that uses it frequently and there is interested in doing some clinical trials in the US, and perhaps that'll be an option, but I just don't think it's worth doing at this point in time.
So is the photodynamic therapy not selective then for melanin or hair, so the hair will be spared?
I think there's a little bit less, they're using a lower energy laser, so there'll be less injury to the hair.
Will be very interesting to see if they've done any studies. So Cheryl asked another question. Do you know if insurance will cover these new treatments in New York if we're from New Hampshire and come there to you for treatment?
In our case, it's just part of the treatment. So, I'm sure not even sure the insurance company is aware that a second device is being used. So it's not been an issue.
And it's safe for me to always say your team is amazing with trying to get insurance approval. And if they can't, we do have the VBF flat fee, which is so many people really need that option because they just have no other option. And I'm very thankful and grateful that we do have so many patients. One of your patients that comes from Croatia is coming back because she's not happy with the treatments in Europe. So she's going to come back and stay a couple months with family in Brooklyn so she can just come to you and have her son get treated as frequently as you will. He's young, David's, under 2. And sometimes that's what they have to do. And, bravo to these parents. There's no barriers for them. They don't care if they have to hop on a plane and come. They take care of what has to be taken care of for their child. But I'm hoping in our lifetime that, we'll be able to get a little bit more fair access and better treatments for everybody. That's my dream.
But going back to this insurance issue, self-advocacy, I guess, is particularly important. And one of the things we sometimes encourage people to do is to even contact their legislators, because they often want to be advocates for their patients, and they can put a little pressure on the insurance companies. And if need be, a letter from an attorney this is reconstructive surgery. This is not cosmetic. This should be covered.
We also have a booklet on our website called How to Appeal an Insurance Denial that gives the verbiage that they have to use in their appeal. It's pretty successful. And also Dr. Cohen, who's semi-retired, is working with us to actually provide letters of medical necessity for some families to keep them busy. He likes doing that for families. So if they're not successful in the approach that you're recommending on their own, then we have some options for them and they can just reach out to us. Christy wants to know if someone has Sturge-Weber syndrome, is it safe for them to have laser?
Absolutely. We treat Sturge-Weber syndrome all the time. There's no reason why you can't. There's nothing that's going to exacerbate glaucoma in the eye or exacerbate a seizure disorder. So it's all fair game. So there's absolutely no reason why these patients cannot be treated. We do it routinely.
And I just want to reiterate, because Dr. Cohen, Dr. Comey, who is our Sturge-Weber syndrome expert, was on with me in November and made that same statement. Laser has a fraction of 1% of a chance of triggering a seizure. So she says it's safe. And that's from, the Sturge-Weber expert. So one of your patients, Dana Porter Strauss, says, thank you, Dr. Geronemus. We love you. He's the first doctor to give Allie a chance and actually agree and attempt my miracle baby girl at a few weeks old, broke boundaries with my consent. So wonderful to hear those testimonies, huh?
That's one, yeah, makes my day.
And of course, our buddy, Megan Elizabeth Curley's on right now. We talked about you, Megan. Your clearance is amazing. So we'll be using your pictures for show and tell. I'm very happy. And Megan's getting married, so I'm excited for her. Dr. Geronemus, she's saying you were honest. He knew 19 years ago when he could no longer help or treat my daughter, and he advised and supported us. So that's wonderful. Shelby from Utah says, my 9-month-old daughter has a dark port wine on her thigh and it's already covered in blebs. They bleed significantly and frequently. She has an appointment to have them cauterized and they're going to patch test using an ND-YAG. Do you have any thoughts or advice on this?
Well, my thought is that this is probably something more than a port wine birthmark.
That was my first thought.
So I think further evaluation will be required.
Yeah,
so
please.
It's unusual to have the blebs at this age. So you have to think about, I'm sorry to say, but an underlying vascular malformation. I'm not sure what type, whether it's lymphatic or just a mixed malformation, but I think further testing would be required, or imaging at some point.
And if you want, Shelby, you can email me at vbfpresident@gmail.com. My email will be posted in here along with the email for Dr. Geronemus's office. And because it could be angiokeratoma, it could be verrucous, could be KTS. But at that young age, 9 months with blebs that are bleeding, it's likely not just a port wine capillary malformation.
No, we gotta say it's not.
Yeah, it's not. So
let's be definitive, yeah.
Yeah, so before you start, let me know. And also there is a vascular anomaly center in Utah, so I'm not sure where you're going, but email me so I can give you that information. You can also find it on our website under Find a Doctor, and then type in Utah and you'll see Grimmer. He was at Boston Children's Hospital, and I believe he runs the program there. Okay, so I'm going through all these. Dana said, Dr. G used to treat my baby every other week, so that was progressive. Jennifer says, is it true, Dr. G, that a hemangioma doesn't go away and can turn into fat?
Some hemangiomas do not disappear completely and can leave what we call a fibrofatty growth on the skin, which would require a different type of approach. So I would say most hemangiomas go away, but some of the larger, thicker ones can leave that fibrofatty growth that would have to be addressed differently.
Okay. Can laser be good for a confined area that you do not want to ulcerate? So, I mean, or it can be. I think maybe like if that's like in an area that's clothing bearing, yeah, you want to make sure that that doesn't ulcerate. Although I don't know, like port wine stains don't ulcerate as much as they can, they do, but not as much as like an early proliferating hemangioma. So I think you always have to make sure it's the right diagnosis first. Megan's Elizabeth Curley, she says her fiance wants to know if she stops the treatment with you right now, will it come back?
Well, first of all, tell the fiance he's a lucky guy.
Yes, there you go, Megan. He's a lucky guy.
I think, we don't know for sure. I think it's unlikely, but I wouldn't be surprised if some maintenance therapy would be required.
Okay.
But, we're at a point now where we're actually seeing significant clearing in Megan's birthmark. So the more clearing we get, the less likely that is to recur.
Agreed. And even if she has to do one maintenance treatment a year or something, it's not a lot. Claudia says, I love these Facebook Lives. They are so helpful. My son Aurelius is a patient of Dr. Lord. I think Dr. David Lord is in Australia or New Zealand. We started treatment at 6 months. His face hasn't been getting lighter, but his extremities have. So it's interesting. I read a paper several months ago about using topical sirolimus as well as laser to get even better clearance. Do you have any info on this?
I've tried it and I haven't seen much benefit from it. It's a fabulous idea. I think there'll be next generation drugs that'll probably be better. So we saw more issues from it than we saw benefit, including irritation. Sirolimus is not a drug that you can buy topically in a pharmacy. It has to be formulated or made up. And there are often a lot of issues with making it in such a way that it's comfortable in terms of its application, doesn't cause the irritation that we saw.
I've been hearing from some of the moms that they did have to discontinue it because the irritations were actually becoming like ulcers.
That you don't.
Yeah. Paige said her daughter's been getting hyperpigmentation the last few treatments. Is lengthening the healing by weeks any way to avoid this?
So the hyperpigmentation, first of all, is more common, one on the extremities, and two in patients with darker skin. So people who are Hispanic, who are Asian, who are Black, these are people who are more likely to experience the hyperpigmentation. But again, I do believe that lengthening the interval is an appropriate way to minimize that problem and to help it resolve over time. Also being very careful with the sun will minimize that as well. Sometimes, using a topical bleaching cream could be helpful to minimize that. And there are other types of lasers that we use for pigmentation rather than birthmarks that can be helpful in resolving that. But oftentimes it just resolves on its own.
Thank you for that. Boy, it's been a crazy busy session and we only have 10 minutes left and lots of questions. So good question from Pam. She's 62 years old. She has a port wine with blebs on the right side of her face. She has not had treatment in 20 years. I want to have one so bad. She said her life has been defined and she wants thoughts and, she can get treatment and she should sign up for our clinic in October and Dr. Geronemus will be doing the laser treatments then. You don't have to wait. We have a free laser clinic next month in February in Miami with Dr. Duarte. But for all of this new high-tech, innovative techniques, New York City, October, Dr. G and his team. So again, follow us at birthmark.org and you'll see on the front page all of our— For
this particular patient with the blebs, it'd be a combination technique. So
right.
One laser for the flat component, another laser for the blebs, but the blebs can be treated. There's no reason to live with them.
Right.
And, I can understand the angst or the discomfort or the issues related to the blebs, but it's eminently treatable.
So Naya wants to know, what do you think of the YAG laser for the treatment of a venous malformation?
I think it's a great treatment. There are different types of venous malformations. There are limited confined areas or small areas where the YAG laser works really well. And there's every now and then we see patients who have a very, very extensive venous malformations where other options would need to be considered, including direct vessel injections with a sclerotherapy agent, in some cases surgery. But if it's a relatively small or modest area, then lasers can work quite well. But we often work together with interventional radiologists who can approach it from the inside if it's very, very bulky.
Okay, thank you. And again, I think Sophia is on from our the VBF, and you can post my email and the email for Dr. G's practice in the discussion here in the comments so that people will have access to it. Marina has a question. What's your recommendation for intervals between treatments for babies older than 1 who have completed initial frequent treatments before 1? Should they go once a year, once a month, or as long as you're getting clearance, should you just stick with it?
So a good question, something we deal with. So a lot depends upon how much clearing has been achieved. If they're completely clear, then I would just go into observation and subsequent maintenance mode if needed. If there's a fair amount left, then I would continue treatments, but we generally don't treat them as frequently when they're a little bit older. Maybe that's wrong, maybe that's right, but we will extend the intervals. So after doing a year of treatments, we often take a break just to let the skin settle down and heal. And sometimes we'll see more healing as a result. One of the issues that we sometimes see with repetitive treatments is a little bit of eczema or a rash on the skin, and giving the skin a break will help that heal up as well. So again, over a year after having repetitive treatments, we generally wait a bit longer, sometimes 4 to 8 weeks between treatments.
Great. Gail Friedel Greenwood said, "Hi, Dr. G. I'm from Ocean City, Maryland. You treated her son Jack 16 years ago at 3 weeks of age. You progressive person, you. 16 years ago." She said they took a long break, but he's thinking to start back up before college. And he wants to know, she wants to know, is he a candidate for the every week at his age?
We don't know the answer to that, Gail. The weekly treatments that we've done have been in the infants. One of the reasons why it works so well in the infants is they don't get the bruising that we see in someone of Jack's age. So I would say probably not, unless we chose to treat at what we call a subpurpuric or non-bruising approach. But this is all evolving, so ask me this question in a year, it might be different. But I would say we would want to wait for that bruising to disappear before going ahead with the next treatment. Otherwise, we'll end up with a lot of pigmentation. Although I recall that Jack is fairly fair, he's not particularly dark skinned.
Well, you'll find out, right?
Here we go.
Yep. So Jennifer, thank you so much for raising that $500 for VBF last year for your 30th birthday. That $500 sponsored a family to come to California to our conference. They got free lodging, free laser, free psychotherapy sessions, free ultrasound, free dental, free orthodontics. I don't know any not-for-profit that does what we do, especially the lodging and all of these free services. So I can't thank you enough, and just know that every penny is going to help these families.
I have to give you a plug. I mean, this is remarkable. What Linda just said is just simply remarkable, to offer this to patients. And you're right, I'm not aware of any patient advocacy group that goes this far, to have these types of sessions where patients can get direct information from physicians and other experts, to have the opportunity to meet with experts, to have the opportunity to have treatments. It's simply amazing. Congratulations.
And for free. So Molly, her 4-month-old grandson has port wine on 50% of his front torso, the majority of his back and his left leg. When do you recommend starting treatment, and when will any limb overgrowth be seen?
How
He's
old is this child again?
He's 4 months. 4 months.
I would treat as soon as possible, and do as many treatments as possible before the age of 1. If you have a physician in your area who's willing to do that and has the expertise. In terms of limb overgrowth, sometimes we see it very early, and sometimes we don't see it until much later, during childhood. But I have seen it at birth, but that's uncommon. But oftentimes by 1 or 2, you can see some discrepancy between the 2 sides, or in terms of length or width of the leg.
And according to Dr. Rosen, usually the discrepancy, if it's subtle, it'll stay that way. If it's profound, it'll be that way. So if you're not seeing it, even if it does come out, it's probably going to be subtle. But stay on top of it. Stay connected to us. We've only got 4 minutes left. So Stacy Lynn says her daughter's receiving her first sclerotherapy on her eyelid at Children's Hospital of Philly. Do you have any recommendations for us? I don't even know I don't know if are they sclerosing a malformation, or I don't really know of anyone who would do sclerotherapy on an eyelid for a port wine. Do you?
It wouldn't be port wine. It must have a different diagnosis.
Yeah, it must be like venous or
venous. Most likely a venous malformation.
Yeah, it must be. Yep. As we wrap up here, so Jennifer is saying her daughter has a hemangioma on her lips and gums and on her face, but the one on her face is going away. Her derm is talking about surgery when she's 3. Hemangioma keeps it contained but not shrinking. Do you recommend surgery so young at age 3?
Without seeing the hemangioma, it's very, very hard to say. There are some instances where surgery is extremely appropriate, but it's not common. So it's hard to say without having more information.
Okay. So Shelby clarified, and she said they do think her 9-month-old has KTS. So if it's just a mild discrepancy, that's likely what it's going to be. But, starting compression, get that baby, that 9-month-old, into swimming classes, do what you can to keep circulation going in that leg. And Jackie Ruvolo Lennox says, Dr. G is our hero. We were so lucky to live in New York City when she was born 9 years ago. It's great. They thank you for treating their beautiful little girl, they said.
My pleasure.
Okay, so we're wrapping this up. And July Feliciano, good morning. Must be from another part of the world. I want to ask if sirolimus treatment is effective for microgioma, my lymphangioma, hemangioma. Send me some pictures of this, because lymphangioma, hemangioma is your mix. It's a mix, though that's not likely. The term lymphangioma is not even used anymore. It's lymphatic malformation. So if you want to send me some pictures, I can have, if you're from Europe, I can have Dr. Coletti look at them, but I'm not quite sure what you're talking about. So it's kind of hard to ask Dr. G when you're saying lymphangioma, hemangioma. How about how young to start lasering the eyelid?
We start as young as possible. We use a protective eye shield. So what we do is we put an anesthetic drop under the eyelid and place a shield underneath the eyelid, so we can treat the eyelid very safely and effectively. So for us, it's routine. There's some physicians are not as comfortable treating the eyelids and placing the eye shields, but once they become familiar with it, it should be done routinely.
So as we wrap up, Scott Couples is saying hi to you, Dr. G.
Hey, Scott, you're due for a visit.
And I was just going to say, give him a little nudge and remind him. Everybody is saying thank you so much, and they appreciate your expertise and your time. It's been an amazing session. We had over 65 people on at one time at the most. So that's the most we've ever had on at one time, Dr. G. So we did a banging session today. Okay. thank you so much for, at the last minute agreeing to do this as a Zoom. Thank God that we do have this as an option for when weather and COVID and things like that happened. But thank you very much. We're all very grateful and appreciative of your time. And
well, thanks for all that you do, Dr. Linda.
You're welcome. And I'll see you soon. So
all
thank
right,
you all very much. Thank you.
Bye-bye.
Let me end.